Diagnostics. Today we're bringing you a report analysis and review. It's a method developed by Dr. Daniel Beelan on how to review the AlphaView report and apply the information clinically to your patient's case. Dr. Beelan is here. He'll review this report that's in front of us, and so is Judy Robertson, who has provided the report. So, Dr. Beelan?
Hi, Jackie. Hi, Judy. Thank you very much for this opportunity to go over still another alpha thermography analysis and strategy session. Judy, we're going to go over a patient that you've had, and I wonder if you can tell me a little bit about that patient just to orient towards where we're going and where we want to end up with the results of the report.
This is a 54-year-old woman who came to me in 2011 for thermography. She was at that point diagnosed with stage 3A colon cancer, which was found through surgery in April 2011. One lymph node was involved. She had a severe reaction to the anesthesia, and prior to that, in 2009, she had a badly infected appendectomy. Her appendix was badly infected. She had had a lifetime of allergies, beginning with a formula as an infant. At that time, she had 7 amalgam fillings and 5 root canals, including 3 large intestine molars. Now, this time, she called me after having gone through chemotherapy and a number of follow-up therapies with Cancer Centers of America, and she'd been determined as in remission from her cancer. But in March of this year, she had a CEA of 6.6, which began to make them wonder if things were starting to turn around again. So at the end of March, she had another CEA, which came out at 7.8. In May, it was at 25. And now, mid-June, she was at 40. She came to me after the first CEA in March and had this thermography done. And based on the findings of this report, she went in for a number of studies. She had a CAT scan where they found a small 1-centimeter mass on her liver, a PET scan which found radioactive sugar at the site of liver metastasis, which was indicating cancer. But they did a liver ablation with a biopsy that didn't show anything. With autonomic response testing, they've been finding parasites. It's a complicated story, and she is really hoping thermography can help give her some more insight, so we'll test her again next week. But it would be very helpful to understand this very well before we go into the next test.
So what you're saying is that this woman who probably had at least a partial colectomy, does she have a bag?
She does not.
And then did she change her lifestyle during the present time, and when she had the surgery, did she do anything different?
She did do a number of things. She had all of those root canals and amalgams removed, is one thing. But as far as eating habits, I am not certain about that.
So this kind of a case category is recurrence of colon cancer, and what do we do with it, because it's extremely serious. Any recurrence of a cancer, number one, you have to do something different. Number two, they may not respond to chemo, and they're in a very difficult rock and a hard place. So we're just going to try to glean some information that might be helpful to build up her internal terrain, but you can't approach her with an idea that, you can take away the recurrence. It's, always a difficult situation to be in, whether CEA increasing with a possible liver metastases. That's what CEA means, and we all pray that CEAs don't go up like that and change a lot, because if they are a marker, and it appears that that is a good marker for her, then, at least you have the marker, and as you do different things to the terrain, you may be able to slow it down. From what you've shown me, she's gone to a slightly elevated CEA to a 40 in like 3 months. So here we are between a rock and a hard place, and let's see how we can just be a little assistance here. It is interesting on this first page that we do see this physiologically compensated signature pattern, which shows that there is some kind of compromise in the terrain or the biochemistry of the interstitial fluids and their influence on the regulation capacity physiologically, that she's not responding to stress in an organized way. There's a disorganized reaction to stress, which is the whole reason why this and how this has developed with our technology, with other technologies that use the regulation response, like heart rate variability, she goes into a chaotic pattern, which is not very promising. She also has an index of toxicity, high pelvic toxicity, which could be a mixture of that activation of positive metastases and also from the surgical impact and trauma and subsequent adhesions. And the lymph involvement doesn't mean very much because whether there is or there isn't, it's not a real good predictor of recurrence or not. And then then you go to her lymph system and you show a viral sign. Now I'm going to take you to the chart, and here starts the method that we should carry out with all of our patients, whether they are chronic fatigue or broken fingernail or with a cancer. And the first is we want to assure ourselves that the baseline is at a decent mid-level, between 31 and 36, which it is. Means that the sensor is calibrated properly. And then we look at these GL readings. There's 2 of them. This first one is a little bit paradox, but only about 0.4, so that's okay. And then this one is more normal. The ideal would be that the second measurement rises a little bit, 0.2 or 0.4, but this is about the same as the first. Well, the first reading is a little bit lower, but it still qualifies the thermogram to be a good thermogram. Then we want to look over the whole thermogram for blocked points. Since the head has blocked points often and they don't have that much meaning, we look at other things in the head. The blocked points in this thermogram are only really in one pertinent region, which is the lymph of the neck, where we have the rigid column, and area 2, which is the neck, 38.5% blocked, which is meaningful and significant. We have these other cooling down, which is a toxic sign. We have the blocked sign. Here we have the thyroid, that's a little bit paradox, but then we have the thymus block. So really, there's a lymph block as what you should carry into when you look at the rest of the thermogram. Then the second step is to look for very hot and cold points to see how big the spread is. And we see some very hot points in the mastoid. These are not that hot, but they're warm. And then we see this toxic cold reaction in the pelvis and in the kidneys, also in the breasts. So there's a fair range. You can count from the lowest point in the lower abdomen up to the highest point in the right mastoid, about 1, 2, 3, 4.5 or so degrees, which isn't a lot. So there's nothing really significant. We're really looking for things that are 3 degrees above or below and making the total distance between them 7 or 8 degrees. So there's nothing significant there with the hot or cold points. And then we look for side-to-side differences. The first place I'd like you to look is in the cubital fossa. And you always look at the end cubital fossa, not the first one. Here we see the first cubital fossa that's not quite as accurate, shows a big side-to-side difference. The right side is so much warmer than the left side, but here on the second one it evens out, and the right side is still a little bit warmer. So we might want to keep in mind that maybe the worst thing that we're looking for, the thing that can unhook some of her immune system, so to speak, is on the right side. So we want to keep that in mind and remember the liver is on the right side, as well as we want to look at the teeth and we want to look at the tonsillar areas. So do we see any more very important right and left sides? Well, the kidneys are symmetrical. The back is symmetrical. Then we look over to the heart, where these heart points are symmetrical. The IC1 and 2 are a little bit asymmetrical, which could mean that she might have a little bit of arrhythmia or electrical conduction problem. The sternum is hyporegulating. That's important, that there may be something in the chest. And the other side-to-side differences we look at in the head, where you see the right side is warmer than the left, the right side is warmer than the left, the right side is warmer than the left. We see that pattern. We're always interested in the warmer of the two. And here you see on the right side is colder than the left. And here a little bit of asymmetry. So there is some asymmetry in the head. And then we look in the teeth. There's quite a pronounced asymmetry in the upper jaw, the 32.4 on the right and 31.8 on the left. And you can clearly see that here on the teeth, that the right side is much warmer. So this warmth could point to where there might still be a cavitation from a tooth removed, or they may be remains of amalgam or something. So I would look in this warmer right side. Then we want to look in this rigid column and make sure that she doesn't have the heavy metal signature, which means area 3, 4, 5, and 6 would have numbers in them under the rigid column, and these are all zeros. So it's not a heavy metal picture. She may have them, but it's the least of our worries. So it was the block spots, the cold and hot, and then the side to side with these certain areas. The key thing is to remember the areas to look at for those. So in the blocked, it's from the neck down and the breast. For the hot and cold, it's over the whole thermogram. For the side to side, it's in the cubital fossa, the kidney back, the heart, the head, and the teeth. So now we're going to go to the first page, because now we have a very good indication for where we're going to want to unblock her. And we want to underline the severes and the moderates here. So I'm going to just outline this for you. Here we have a severe general toxicity. So any cancer patient is very crucial to start their drainage through kidney and liver function, so that when and if you're able to slow this down or to break up any of the tumor to make it more vulnerable to the immune system, you're going to need an exit route for the metabolites so that you don't compound the bad terrain. And so this is also indicated that you better start a detox. If you have liver remedies, kidney remedies, infrared sauna, drinking lots of water, sweating, all of the detox plans, these are what is crucial to do as a first step. Here there appears to be a severe vulnerability to this terrain that's very challenging. Then you have a minimal autoimmune, so I doubt that that's real, because it's very unusual to have a cancer patient that has an autoimmune disease, because cancer usually means the immune system is not strong enough, not that it's overexerting itself and has the energy to pose as an autoimmune problem. However, she could have a past history of autoimmune thyroiditis or something like that, but I doubt it because of how the thyroid looks. Do you happen to know if she's had a thyroid history?
I do not.
Many cancer patients, as Virginia Livingston and other notable oncologists who are in this field have said, many cancer patients are low thyroid. There's a lot of evidence that when you bring the thyroid up to norm, people's immune systems come up. So then in the head, we see a minimal cerebrovascular, so this is circulation to the brain, a moderate TMJ, well, you saw that in the side difference, moderate degree of viral hint. So I might ask for a history of viruses, and I would also include that in my strategy. Do you happen to know if she's had any of the shingles or Epstein-Barr?
I don't know that.
In the neck region, the moderate lymph block. So in addition to the antivirals, you want to treat with lymph medicines. She might have old tonsillitis. She might have a present tonsillar engorgement. You want to look at the tonsils, consider treating. This airborne allergies comes up when there's toxicity to the chest, which is indicated by the hyperregulation. But, you know, that's, again, she's a very toxic patient, maybe made worse by chemo, but, you know, that's the result of her not getting enough detox while she's getting chemo, and it's very difficult not to, you know, give patients something that's toxic and from them not to end up with a problem that they'll need further detox treatment for the next year or two or three. Then the possible pancreas toxicity, that's possible where the origin of the colon could have been from pesticides like the pancreas, but we're only guessing from here. It's all guesswork. We're not here to try to find the answer. We're here to assist her own body to be stronger and to be able to get as far out of this and to prolong her life as long as possible and build her strength. Again, the food intolerance is, you know, important, that she's not eating things that are associated with cancer like sugar, cow dairy. I would probably put her on pretty vegetarian alkaline diet and take her off of any wheat and minimal sugar. Do you happen to know if she's doing that?
I get the feeling she's struggling. I think that she may be trying, but they're not doing it wholeheartedly. But I will definitely bring that up.
Okay. So then there appears a severe pattern. Remember, that's one that we're going to underline for endometriosis or pelvic toxicity. So from the trauma that she's had to the area, this causes lymph to not move as well and circulatory venous return to be slacking. So, this affects the whole pelvic and peritoneal cavity. So it's always going to be showing up. And that's just part of what comes with this. Minimal pattern for uterine hypofunction. Does she have her uterus?
Yeah, she does.
And how old is she? 54?
Yeah.
So is she still menstruating?
No.
Must not really turned off with the chemo. Kidney toxicity, like we said, appears to be a dental focus. Some cancers can come from infections originating from the teeth. So it should still be investigated. She may still have, in some of the cavitational spaces, some very pathogenic bacteria, and she should be really treating that and having it investigated by a good biological dentist. She has a little TMJ in neck, which might not be the first place to do anything with. And then she has a little bit of stress right to left breast. That's the least of our concerns as well, because her problem is lower down where the CEA has shown us there is something going on with the colon, liver, and a threat there. Then we see a pretty accurate priority for treatment. Sometimes maybe 4 out of 6 are really well reflected in this because the software can only choose on the basis of how our data has accumulated over the years, and so it's possible for 1 or 2 of these to be not quite accurate or misidentifying something that's really key. I think here there is one thing that's not really identified, and that is the teeth. You're going to want to draw in right here, priority dental, and then dental exam. And everything else is the compensated pattern, the toxicity, the pelvic toxicity, the lymph, the viral. This is all very accurate. And then we have the recommendations that start off with orthodox school medicine treatments, and then like here, consider SED rate, investigate for pelvic inflammatory, CA-125. That's where your CEA would concern. I would still do a CA-125. Then for the integrative medicine, consider biological medicines, endocrine balance, antivirals, lymph, CBC, throat culture, viral panel, probiotics, L-lysine, and then investigations of the jaw. Here we have our second page, and this is our 2D diagram of the synthesized behavior of the points as they're projected and colored according to the behavior. And you'll notice that the ideal is this light blue, so we see mostly this dark blue everywhere, which is the hyperregulation, which means that when you stimulated with the cool air, everything overcompensated and the capillary beds overconstricted, making the skin too cold, indicating that there's a toxic load in the majority of the body. Here's a close-up of the neck. We only see up in the neck some blocked lymph and some inflammation with the yellow. That's right down here. That means paradox is inflammation. The darker colors are the hypo or blocked regions. We look at the cubital fossa, those were okay. Sometimes if one is bad, one will be blocked or different than the other side. This tooth diagram is not easy to see as well as the head. We do see this blocked sinus on the right side. Again, that reminds us of something on the right, and then we see these paradox teeth on the right. So this is where I would look. I would look on the upper right in the teeth for anything more that needs to be cleaned up by the biological dentist. As we see this, there are 4 different indicators for the teeth. One is this speckled look, which she has none of, and this means that there could be an infection in the root or in the tooth region. There's none that are reflected here in either this gray or speckled. But there is this polka dot or dotted teeth that's the loss of the normal curvature of temperature when you go from the front teeth to the back, they should get cooler and cooler gradually. But these three teeth didn't change at all from each other. They stayed in a straight line. That could mean that there's some kind of process here in the jaw. Maybe this was where she had some teeth removed. I would look at that area and see if there's anything going on there. And then you see the black teeth are the toxic so-called teeth. These might have had amalgams and they're still residual around, or they can be gingival problems. You'll always see either the speckled or the dotted indicators being reflected down here in the connections of the tooth and meridian systems. And it's very important if you have a disorder like this. Look, here tooth 4, 5, and 6. Here's 4, 5, and 6. So this will reflect either the speckled or these dotted teeth. And here we have lung, large intestine, liver. Here we have exactly where we're concerned. So this might have been the original source, but now we have a problem that it's taken off into those organs. But you might have a direct viewing of the meridian validity with a case like this. It's very interesting. And of course, and then this is on the right side. I would imagine that where she had her tumor was on the right, on the ascending colon, or the right part of the transverse colon, or in the cecum. Those are all on the right. Do you happen to know?
I don't know the exact location, but I believe it was on the right.
And then the jaw is hotter. That's our fourth indicator, which is the red arrow, just showing that the jaw is warmer on that upper right. So that's indicated for people who do neck and TMJ and osteopathy and things like that. So then we have our best page, and the most important thing here is how many criteria out of the 12 are positive, and here only 5. We only worry if there's 6, 7, 8, mostly 7 or more, and here she only has 5. Here's the asymmetry of the breast and a little bit of the lymph index and terrain index elevated, and then the things we know, the tonsil, the lymph system, and the organization of the response in the breast are a little bit stressed, but it's not something to worry about with this at this point. This is coming from the rest of the body, the physiologically compensated. The lymph load is a big factor that needs to be dealt with, and here you see the distant related focal means that there's a possibility of a hidden infection in a tooth or a tonsil or an appendix or an ovary or something that's distal that's causing a distant effect and setting up a disturbance field. Now we have all of the signatures, and you circle the moderates and the severes. So here we have toxicity, physiologically compensated, TMJ, virus, TMJ again, lymph, head emphasis. So this is telling the doctor, hey, especially look at the rest of the body, because if you were a doctor without this method, you might be only paying attention to the abdomen or the liver, and it's very necessary to clear also what's happening in the head region. Here we have that airborne allergy, but I think that's just coming off of the hyperregulation or toxic response hyperregulation. And then here we have the pelvic toxicity. That is just a way to cross-correlate your suspicions. We end up really with, hey, let's pay attention to the teeth, let's treat the lymph system, let's possibly consider antivirals, but we really have to detoxify all of the methods you know, whether it's through the skin, through the intestine, through the liver, through the kidney. Those are what this patient needs in order to assure her of the most amount of time here on this planet.
This was a really good example of not only how to go through the case, but go through the report, but how to apply the information from the report to a specific case. You're going to see pancreas toxicity come up, and a lot of these priorities come up for different patients, but you have to know how to apply the information to the specific case.
I can't really tell you how much, I get emotionally involved with a case like this, because it's evidence that the person needed surgery and then chemotherapy, yeah, maybe, and then they leave the patient off and say, okay, you're free to go and you're in remission. The patient's led to believe that and doesn't really understand, and what every patient needs to know that's ever had cancer is the terrain can recreate what it remembers. You have to really change the software. You know, we have our bodies and we have our organs, but really you have to figure out what's running the body. Has to go through some form of a transformative change. That's what regulation is all about. It really is an interface between the mind and the body, and how the brain and nervous system is in such a close interface with the cells of our body that this method for measuring the nervous system and how it directly plugs into different organ systems is absolutely crucial to be monitoring. I don't understand why every doctor in the world doesn't use this method or some method to analyze the neurological control mechanisms of the tissues and organs, especially in someone that's had the direct threat of a tumor when it was first discovered.
Well, thank you very much for giving this presentation, Dr. Beelen. I'm sure it will be a great help to all of the physicians who are learning how to use the report, analyze it, and apply the information to their cases. And thank you, Judy, for providing this example.